In week 5 and 6, we're going to take your virtual skilled nursing facility patient population. We're going to take the building that you have envisioned with all its rooms and colors and safety regulations and layouts and pieces and parts, and start thinking about how are we going to take care of your patient population within this structure, and who is going to take care of your patient population within this structure. So when you're starting to think about who takes care of patients and how they take care of patients or residents, as the case may be, it's very important to think about the model that you're going to use. And there are a variety of models, and I have to say that I'm very inculcated in the medical model because as a physician assistant of 30 years, that's what I've lived. Medical model involves physician-directed care to skilled nursing staff, physical therapists, occupational therapists, social workers, etc., to take care of a patient. And that's how the medical model thinks about it, as a patient. This person is a patient, not a resident, not a client, not all the other words and descriptors we tend to use, but the medical model really thinks of people that are in the facility as patients because they need medical care. And medical care is generally delivered to fix something that has happened versus preventing something from happening, and is not overly suited to custodial care. So this is something to think about as you look at the various models and who shapes these various models of care, because long-term care that involves skilled nursing care, which is what you're building in your virtual world, is actually a mix of the pure medical, which is physician-directed, and custodial to some degree. You're building essentially a home for the residents who happen to be patients. Or maybe it's the other way around. You're building a medical facility for the patients who happen to be residents. You can look at it from a variety of situations. So as you're reading about it, think about who you're going to have working for you. Now that seems like it's a pretty simple answer. Obviously there'll be physicians, PAs, nurse practitioners, RNs, LVNs, CNAs, physical therapists, occupational therapists, speech therapists, pet therapists, chaplains, social workers, housekeepers, food service personnel. I had to think about that one for a second. Food service personnel, the maintenance guys, the lawn care guys, all the vendors that come to your place. That's a lot of people to think about. But what about who and what they really are? This is where you're going to be thinking about more on the lines of human resource process, is who are these people? You can hire a nurse or a PA to come work in your virtual long-term care facility, but what are their qualifications to do that? How do you measure the quality of a person as a physician or a nurse or a housekeeper against their experience as a physician, nurse, or housekeeper? Because it does make a difference. If you're opening a brand new place in your town to serve the population that you have, and it's a lovely new facility, and everybody in the place just got out of college from their variety of degrees, and or they just got a high school and are a housekeeper or a groundskeeper or a plumber, how good will your care be to your patient/resident? Now, it might be really good because those are all eager, energetic, want to be there, haven't been crusted over by years and years of experience, easy to teach, accepting of the new electronic medical record that you've installed. That's all good. That might work. However, there's always an however, as you well know. However, you may need to have some experience. You may need to have a head nurse that's been a head nurse for 20 years. You may need to have a facility manager. I guarantee you do, actually. You need a facility manager who knows how to worry about the firewalls and the safety issues and whether or not the plumbing's working and how to fix the plumbing if it's not working, and to call the right IT guy when the computer system goes down, etc. You need that facility manager to have some experience. You don't need the kid off the block that just got out of school yesterday. So look at the quality of the employee that you want to hire and the mix, and this is the key part, is you're going to want a mix. You want a mix of somebody who has experience, who has knowledge of running a facility or working in a facility of your type. And you want fresh people who come with energy and new ideas and the most current learning. The person like myself, who was trained 30 years ago, is very used to paper and pencil for medical records. And over the years, I had to learn how to use the electronic medical record, but I'm still happiest when I'm writing on a pen, with a pen on paper. Your new out-of-school physician assistants, RNs, CNAs, hemodialysis technicians who come in to do your patients with end-stage renal failure, they don't know how to use a pen and paper very well. They know how to use their notepad and their computer and the electronic medical records, and they know how to glean the information out of the computer so they can do the coding and the billing and the reimbursement part. They know how to do all that. So you want that mix. You want the new, but you want the experienced and something in between. So when you're building your staff over the next couple weeks, look at the different models, look at what the different jobs entail, and look at the staff mix, not just of how many RNs do I need to how many physical therapists do I need. It's also the mix of quality and experience and energy and new knowledge, things that will keep your organization thriving over time to meet the needs of the population. Because the bottom line is all of these people are meeting the needs of the population that you are taking care of. Remember, there's a person attached to every single bed, and that is who you're building a team to take care of. So it's important to do it well, to train them well, to have opportunities for them to get better at their jobs so that they want to take care of the patients well, and they don't leave them in squalor or turn off the lights to make sure they trip or fall, etc. You want them to be good and happy employees and safe employees. So as you're starting to look at that this next 2 weeks, give it a lot of consideration on how you would build your team, and then how that's going to carry you into the future as you build your virtual skilled nursing facility. Thank you. Have fun.